What is public health's responsibility to educate, to inspire behavior change, and to share patient stories responsibly? How can public relations help? In this episode, we have someone who's provided PR counsel to global organizations and spent nearly 20 years working with leaders in the public health space, building public relations plans that have changed legislation, raised hundreds of thousands of dollars for the mission, driven health behavior change, and brought fresh event participants and donors to the table. From PHI Media, I'm Gordon Thane, and joining me for a conversation is Alexson Calahan. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Alexson Calahan is a public relations specialist with almost 20 years of experience in the industry. What can we learn about the role of public relations in the context of public health? Are we doing enough? Should we be doing more? Where are we going wrong? Where are our pitfalls? What expertise can we learn from? These are some of the questions I'll explore with Alexson as we kick off the conversation. Alexson, welcome to the Public Health Insight Podcast.
Thanks so much for having me.
It's a pleasure having you. And I was saying to you off air that communication, PR, is something that I've identified in myself as a skill I'd like to build. It's one of those important public health competencies, especially when we saw how the pandemic unfolded and some of the gaps there around how different information was communicated, the tone, accuracy, mishaps, et cetera, you name it. So I'm a lifelong learner in that domain, so I'm happy to have you here. But right now, you're like a PR expert with numbers of years of experience, but you didn't wake up like that.
No.
You didn't wake up like that. So how I like to frame this is to visualize your career as a Google map, right? So in a Google map, when you put in your starting point and your end point, you see twists, turns, traffic lights, red lights. You're getting off the highway. There's a car accident. You have to move in a different lane. So there's a lot of stuff going on when you have to navigate your career. So let's keep that in mind. And I want to transport you back to your high school days when it was all fun and games. And now you're thinking about this thing called college or university where you have to study something to be able to make a living, ideally something that you're passionate about. Tell me about going back to those days when you did your bachelor's degree in marketing, management, and sociology. What was the thinking behind that at the time?
Oh, gosh. I wish that there was more to tell on that. 18-year-old me. 18-year-old me just knew I loved to write and loved to tell stories and share stories, but I didn't quite know what to do with that. I knew that journalism was probably not for me. I don't love a fast pace, which is ironic now. But at the time I was like, no, I think business will be my answer. So that's why I joined the business school and went more marketing and management rather than actual PR journalism degree with my undergrad. And it was just, I didn't know when I started where I wanted to end up, right? So all through undergrad, I was kind of just like doing the things, playing the game, going on the path, and when I graduated, I realized like, wow, I have to do something with this. I have to find a job that I love. I got a job that I
So right up until then, you still weren't really sure where you would land.
I didn't really have much of a vision. I knew that I loved to write. I know that I am a lifelong optimist. Like I love to work hard and see change, but these dots did not connect to me, the nonprofits, and health would be a good way to do that. So when I left undergrad, I got a job selling classified ads. That is how old I am. I sold ads in a newspaper. And that was, it paid the bills when I was young. It was all right, but I knew that there had to be more. So after about a year of that, I started to realize like what I wanted to do with all of my education was to take it into PR, start kind of chasing that a little bit more. And when I was looking for a new job, I noticed that the communications roles in nonprofits gave you a lot more leeway. You were kind of the person running the show locally, as opposed to being a cog in a machine at a large organization. So about the time that I got my first public health communications job at the National MS Society, I ran communications for a 3-state area. That's also when I started pursuing my master's degree, because I knew that I wouldn't get very far in this world without some more advanced education around what it meant to do PR. And actually, my first week on the job in that first role at the MS Society, I was so embarrassed. I went to the bookstore and I literally bought Nonprofit Public Relations for Dummies. I was like, I don't.
Wait, there was actually a book that was called that?
Yeah, it was something along those lines. It was definitely an amateur move. I had presented myself as somebody who could do this work and was excited about it. And they saw something in me that said that I could.
Right.
And it was a great job. Like, I learned so much in that role, running internal communications. This was kind of like when social media was, do we have a Facebook page or should we not? Like, is this a trend? So kind of being on the front end of that was just really fascinating, and getting to know local folks who had been impacted by MS and volunteers, and just being able to kind of run all that was so interesting. So I knew that even though I might not stay at the National MS Society forever, that this type of role was what I wanted. And what I really wanted to do was, I think when we're thinking about like health nonprofits, we see who are the big guys, right? So I wanted to work for one of the big guys. That was my next move. And I felt like to move into one of those larger, like billion-dollar legacy nonprofits, I needed a little bit more experience. So I popped over to a public relations agency for a bit.
Something I'm curious about when I was looking at this, because it was probably one of the more unique firstly bachelor's degrees I've seen, and maybe I don't get out much, but the combination there and the sociology piece. What did you learn from the sociology piece of your bachelor's? Your bachelor's degree wasn't necessarily health focused, but you still wanted to pivot over to nonprofit health sector. So I want to connect the dots between what you learned in sociology to then why you ultimately did that. I know you mentioned about not wanting to be a small cog in a big wheel, but private sector could use your skills as well. Why not go that route?
Yeah, totally. I mean, that's kind of a chicken or egg question a little bit for me, right? Like, did I learn stuff and then wanted to follow it? Or was I already interested in like human beings and their stories and why is it like this? Like, why is this system turning out people like this? And how does culture impact what we do and the choices that we make, or the choices that are presented to us. So I can't quite say like where that
you had like this
started.
Innate curiosity about that piece the whole time.
Yeah, absolutely. It could have gone in a lot of different directions. But when I discovered that kind of big impact that you can have when it comes to public health and when it comes to public relations, like combining those two things, you're impacting not just the individual, but you have the opportunity to impact on a bigger scale. And that's what I really love about it. Like, I can interact with one person whose story I'm telling, like interviewing them about their health journey. Right. And then when I translate that into a story and share it through the media or through a blog or through whatever channel we're working with, that impacts so many other people. And I just love that, that combination of things. I think that's really cool because, there's not many jobs where you get to say that you're doing both something for an individual and a larger group.
So then you double down with your master's degree in communication leadership with your broader goal that you then got more clarity on, having started your role at the National MS Society. So now take me through that period of your life, doing that master's, maybe exploring other opportunities, where you ultimately landed after that.
Yeah. So the master's program that I did was like an evening program for people who are already in the workforce. And it took, I want to say it was a 3-year program. So it was wonderful. Like, we went through as a cohort. So the folks that I met in that small group, we studied together, we hung together, like we were there for each other throughout the whole journey. And that was really wonderful. It was, so right around the time that I wrapped up that program, I did move to a public relations agency because I felt like I've got the master's degree. I've got a little bit of public health experience here, what we need, what everybody in PR needs. We all have to, no, we don't have to, but a little taste of agency life is good for you, right?
Okay.
Getting some varieties of clients and just some exposure to people who, because what drew me initially, to working in a local branch of a nonprofit was that opportunity to kind of run the show. But even with my master's degree, I still only had a couple of years of experience. I did need to learn from some older professionals and have that mentor relationship.
Okay.
So,
So you feel, so in your training, your bachelor's and your master's, you didn't feel sufficiently prepared to excel in the way that you wanted to, and you recognize the value of getting agency experience, getting experience directly from work experience to be able to apply and test different things.
yeah,
Is that
I
kind of
think,
what you were in a search for?
yeah, I mean, anytime that, you can be, it's great to be the person in the room who's the expert, but it's even better to be the person in the room who's like ears open and ready to listen. That's the attitude that I took into the agency. Like, just soak it all up, learn as much as I can, and then go forth and do something new. So that's exactly where that path led me, which was great. So, yeah. So
Now,
then,
AHA.
yeah, then the
All right.
American Heart
You spent
Association,
you spent
that was
quite a
the
bit of
goal.
time there, so we're going to have to talk about that one.
Yeah, that's great. Yeah. So from the agency, I moved to the local communications director. So I was in charge of all communications in the state of Iowa for the American Heart Association. And that was such a dream come true. I was like, this is it. Like, this is the health nonprofit people think of. This is great. So
yeah, they're pretty big.
Yeah, pretty big. Yeah. So I was absolutely thrilled to have that job. And working in the local office, what you really do a lot of is like there's public health and education components, but a lot of it is event communications, which is very cyclical. You do one heart walk and then next year you do it again, and you do the heart ball and you do that again, and covering a state, all the cities have these things. It was a wonderful learning experience. I learned so much, not just about cardiovascular health, but also about PR and working in rural versus urban settings, because I had the whole state of Iowa, which has kind of got all sorts of different places. But after about 2.5 years there in the local staff, I joined the national staff, which was really rewarding. I took on a role as the engagement manager. So again, this was kind of a step away from traditional public relations and more on the social media side. It was really cool. I was the first dedicated staff member to run the social media accounts for the American Stroke Association and built some awesome things there. It was really fun, got to know a ton of great people, and just really, it was a time where the American Stroke Association was really growing and like being out there more, talking more about stroke. So it was a really exciting time to be in the organization. Then there were some reorgs, as there tend to be in large organizations. So bipped around a little bit within there, managed some other different parts of the business, still kind of focusing on communications and social media. But eventually where I landed was a member of the team working on patient program public relations for the national organization of the American Heart Association. I have loved that. It was really fun. It was a difficult job at times because it really became a lot about, telling story, finding the right story, telling the right story, and just like having a story that fit every profile, So you had to know a lot of the volunteers, a lot of survivors. You had to have kind of your, oh gosh, this is going to date me again, but like have your Rolodex of stories that you could tell when you had a media opportunity. And that was great. But then the pandemic hit, which, was a very difficult time for everybody working in public health. And I was no exception, being the person whose job it was to tell stories of the folks who were living with chronic heart conditions and stroke survivors became really, really hard. Like in March 2020, wanting to get out there, be the first ones out there with information for folks who, we didn't even know if they were at higher risk, but it makes sense, right? Like they,
and then even with the waiting time for surgery and like capacity,
it was brutal. So, but again, I'm really grateful from that experience because we all learned so much, just constant pivoting and working so hard to get the information out there to help people, even when we didn't have a lot of information, just to say, here's what we know. Make sure you have your medicines on stock, and here are some things to do and things like that. But after about a year and a half of being the person who interviewed the survivors who had a stroke and had to recover without any human contact, and the spouses who had lost their partner because they were afraid to call 911 when they were having a heart attack. I mean, that wore me down. So a year and a half into the pandemic, I needed to step back from the American Heart Association. And that's what I did. And that's when I started my business that I run today. So it's definitely a twisty path getting here, but I also feel like it was written in the stars and I was always meant to land right here.
Sidebar, did it ever feel that there was competition in messaging with obviously COVID-19, and then there's chronic diseases that are exacerbated by COVID-19, but COVID-19 is the more important thing right now, so that gets a bit suppressed. That's the spiral that you're referring to about how difficult it was to navigate?
Yeah,
I mean that your career.
Yeah, that made it hard. So finding the convincing, a big piece of public relations obviously is media relations, and that's a really, during the pandemic, especially early pandemic, that was really important. And I think a lot of reporters were looking for any information. So a lot of people felt like, oh yeah, this is relevant to say, like, if you've had a heart attack, you're at higher risk. And so here are the things that you need to do. But as things drug on, it didn't feel as important, to be talking to this kind of smaller audience when we're thinking about like mass media necessarily. So it became a little bit of a harder story to tell. But I don't know that it never really felt like a competition when it came to the messaging. It just felt like, okay, here's just another layer that we need to add to it. And then, of course, finding those right experts and those right stories to connect to it too.
Small Adventures Communications. I'm curious about the name too, because it's not Small Adventures PR, Small Adventures Communications. So talk to us about even Small Adventures. Where did that come from? What do you do in this organization? How is it similar or different from what you've done in your career so far?
Totally. Yeah. So I'm going to start at the end with communications, because communications is kind of this umbrella term. It's everything that we're putting out, right? Like whether it's internal to our organization or external. So under that communications umbrella is PR, which is where I love to focus. And public relations, for anybody listening who doesn't live and breathe this stuff like I do, that's fine. The way that we define it is PR is building mutually beneficial relationships between your organization and the people who can help you reach your goals. So it's pretty important. We pretty much all do PR all the time. So it's nothing to be scared of. But like in an organizational context, that's how we're doing it. So I wanted to make sure that my business reflect. Like, I don't want to pigeonhole myself, because what if someday I want to be more focused on content writing or whatever. So let's keep it flexible is what I thought. And then with Small Adventures, I gave no thought to that business name. I kind of impulse named my
You're
business.
Supposed to make up a fancy story about how.
No, I mean, my gut feeling there was I wanted to start a business that could pay for some family vacations, honestly. We live in Des Moines, Iowa, and I thought maybe I'll take the kids to the Omaha Zoo sometime, maybe I can make enough to go to the Omaha Zoo. And that was, Small Adventures. That's what we're all about. I mean, really, though, it's like I've come to adore my business name. I adore everything about my business, but the name included, it's reflective of how everything that we do is a little bit of an adventure, or it should feel like one, right? Like I don't ever want to feel like I'm just plodding through and working the plan and doing the things and everything's cookie cutter.
You want to enjoy the process.
I want to enjoy the process, and I want everything to feel different for each client that I'm working with, because they're all vastly different. So yeah, it ended up fitting just great.
So you mentioned you wanted to just earn a bit to take the kids to the zoo. And which probably meant that when you did leave AHA, your immediate thought was, I have to find something else while I do this. It doesn't seem like that happened. So it sounds like you're full-time in your business now. Like, what were some of the processes and things that you put in place, unexpected wins that you can share anyway that helped make that reality come through?
Yeah. So I don't even know how it happened. I feel really lucky.
It's an adventure.
It is, and it's an adventure. Yeah. So a lot of my early business just came from folks that I had known from being, at the American Heart Association for 12 years. I knew people who were still there who had gone to other organizations. So those were some of my first clients, were just people that I had worked with previously who now, were gracious enough to seek me out and want to work with me on a contract basis. And then from there, it's just kind of grown. Like, I'm really intentional about always building my circle, building my network, and getting out and meeting new people. And obviously growing from my existing clients and just making sure that, like, I'm always getting a testimonial. I'm always asking for referrals, because those are the best ways to grow. Anytime you're asking somebody to come in and, like, look at your goals and how you put yourself out there, it can be kind of vulnerable. So that trust piece, with whoever you're working with on PR is really important. And referrals provide that.
Ready to switch things up a bit?
Yes, let's do it.
Welcome to Insight Blitz, a rapid fire segment where I'll ask you questions or read some statements and you'll provide brief responses. Are you ready?
Okay. Yeah, sure.
What is a skill that you learned early on in your career that you still use today?
I would say the biggest skill that I learned early on in my career that I still use today is not bugging reporters. Being concise in my pitch, being compelling in my pitch, and not relying on a follow-up. If you don't get it after one email, maybe one follow-up a week later, if you're not getting it then you're not going to get it and you need to move on.
Okay. All right. So being persistent enough, but not overburdensome. Yeah. Okay.
Yeah.
An experience or moment in your career that completely changed how you thought about storytelling or PR.
Okay, so I have a good one for this. A lot of times in public relations, we, the PR folks, are putting stories out. We find these stories and we're so excited to take them to the media. But every once in a while, it works where the media comes to you. And this happened one time to me where the Today Show called, which was like, what? Great. This is when I was at the American Heart Association and leading the programs around congenital heart defects, CHD. And the Today Show called. They had this awesome story of two kids who had been born with the same defect, and their parents had, like, connected online and they were going to meet in person for the first time. It was going to be very heartfelt. And the producer called because she wanted to verify a statistic. That is all she wanted. How many kids are born with a CHD every year? And I got this email and I was like, I'm not squandering this opportunity. Like, let's imagine something together. So what we ended up doing, I gave her the statistic, but we also hopped on the phone and chatted through, like, what is this story about? It's this very heartwarming thing. These two young kids, these two families coming together. And it turned into me working with our development team and them working with a major gifts opportunity to get $100,000 given in these kids' names to start a CHD research fund through a partner organization that AHA had been working with. And that was announced on the Today Show.
Every year in this country, about 40,000 babies are born with congenital heart defects, according to the CDC.
The diagnosis is devastating for parents like the ones you're about to meet.
Chanel Jones is here to share their story.
This is a really good one. This one will warm your heart. Like any first-time parents, Marie DeSaro and her fiancé, Lou Campanella, were anxious and excited to welcome home a new addition to their family. But little did they know their child's diagnosis would lead them on an inspirational journey.
Amazing. It was the greatest thing that I've worked on.
What's the speed at which, from the reach out to when that kind of aired and was announced?
2 weeks. Wow. Yeah. In 2 weeks, we secured a $100,000 gift, figured out everything that we needed to legally and with the partner organization, everything, made it all beautiful. It was a lot, but it was so rewarding. And then when you look at the final story, it's just gorgeous to see all those talking points, because if I had just given the statistic,
you could have left it there.
that story would have been really different. Like, so many kids are born with CHD and here they meet and that's the end. But this made it like all about, the American Heart Association and the messaging, and it literally did something amazing for science. So super cool.
Okay,
That
I have many
changed a
questions,
lot.
but I'm gonna pause it there.
Yeah.
So the next question: you're hosting a dinner party with your personal heroes, dead or alive. Who's at the table?
Oh my gosh. Jim Henson's at the table.
Okay.
How many seats do I have?
How
Okay.
big you want your? Do
I'm
you
gonna
like to
keep it
have a lot of
tight.
people over when
No.
you're making dinner? You like to keep a small circle? It's up to you.
We'll keep it small. Jim Henson's definitely at the table. I'm a huge Muppets fan, and I just think that would be cool. I love his approach to everything. Like, I feel like he's a fellow optimist for sure. I know I'm late in the game, but I just finished reading Michelle Obama's book. She would be excellent to have at the table. And I feel like I'll need a third person, so it's not awkward. Ooh. It would be awesome to have like a great grandparent who I've never met, but who could kind of see where I'm at. And I would love to hear more about those stories that get lost over time. So we'll say that.
Okay. All right. If that materializes in the metaverse or a dream or something, you're gonna have to come back and tell me about that one.
Absolutely. Yeah.
If you could wave a magic wand and solve one public health communication challenge, what would that be?
Misinformation. Yeah. It feels like
What
a
does
very big
solving it
challenge.
look like? Like pushing a button and it disappears forever, or like equipping the other side with tools to cut? Like, what does that look like?
If the button pushing is an option, I will take it.
You take the
But-
button option.
Yeah, I mean, but if that's not an option, then it's, there's so many things, right? Like, it's improving critical thinking skills, it's improving like the funding for science, and it's improving the funding for, frankly, people like me to tell the story of the science, because it's not just about doing it and people believing it anymore. Just because the CDC that says something, a lot of people don't, they don't go in for that. So having folks rebuild that trust and go into communities and share how these researchers and everybody has the community's best interest at heart, I think they might not solve it all the way, but it would certainly do a
Move
good
the
bit.
needle.
Yeah.
Fair enough. A public health issue that you feel could benefit from more effective PR. Did you automatically get like 100-page list in your brain as I said that?
Yeah. I mean, the news is so wacky these days, right? Vaccination could certainly use some.
Yeah, it's a bit of a weird one.
It is a weird one, but it could certainly use some louder voices on the yes, please get vaccinated side. Here in the US, we've got some measles outbreaks and lots of things going on. Flu shots are always low. And that's one of those basic things, easy to do, takes 5 minutes, and we can make a difference that way.
Finishing up with the worst piece of advice you've ever gotten.
Oh my gosh. That's one I have to think about. I
Or
don't
best.
know.
Since you're an optimist, so maybe best rings more of a bell.
Yeah, I could tell you a lot of good advice. Yeah. I think one thing that was like a mantra throughout my career, every leader, every mentor I've ever had said, don't just be an order taker when you're in communications. It's not up to the sponsor or the program's team or anybody else to decide what type of tactics need to be done here. That's where a communicator's expertise comes in. And so you can talk about the problems, you can talk about the goals, and then finding the way there. Okay. That's what I do. So I've always appreciated that advice. It's like tattooed on the inside of my forehead.
So that brings us to the end of our Insight Blitz segment. Was that too bad? Do you feel like you want to run away? You want to stay with me for the rest? How do you feel?
No, that wasn't too bad at all. It was good.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.